If you're suffering with hip pain, then you need to understand why your femoral nerve is so important to you. Hey, I'm Trevor Cicutti, CEO of SpineWise, and if you are suffering with hip pain and you don't want to watch the rest of this video, just click the link below and let's get you some help as soon as we can. I want to talk to you today about your femoral nerve and why it is so important to you if you're suffering with hip pain. So the femoral nerve itself is a main nerve that comes down, starts from the bottom of your spine, goes through and supplies some of the most important muscles that are around for hip function. Most importantly, supplies three key muscles, and they are your sartorius, which is a big muscle that comes and supplies and supports the front of your pelvis. The rectus femoris, which is a muscle that attaches in a very similar area, also supporting in front of your pelvis, but allows you to flex the leg up and bend your leg up. And your pectineus, which is one of your adductors that allows you to cross the leg over the midline. So one of the things that we see happen quite commonly with people who have hip problems is that if that hip flexor is not working very effectively, then after a while what tends to happen is you start developing this inflammatory response around what we call the femoral triangle. So to understand that, you need to understand the pathway of the nerve. So the nerve itself comes down, as we said before, from the spine itself, and then it passes through a little, kind of like a triangle that exists at the front of your groin. So if this is the hip itself coming out here, your pelvis comes across the front here with your pubic bone. There's a ligament that goes from the front of your ilia, this big bone up here, which is where your belt sits on, comes from there across to your pubic bone at the front here, and basically allows for stability. But underneath that, so if we have this little thing here, underneath that travels your femoral nerve, just like that. The problem we see is that when inflammation occurs around that nerve, what tends to happen is we get adhesions that actually stick the nerve to surrounding structures. Then what ends up happening is as you go to move, especially when the leg is coming backwards into extension, as the leg comes behind, that nerve doesn't slide through the canal like it should, it doesn't move through that hole like it should, and the net result is the nerve actually limits the ability for your hip to extend. More importantly, as you're trying to extend the hip and you actually stretch the nerve, quite often what we see is that every time you do that, these three muscles, the sartorius, the rectus femoris, and the pectineus, all become what we call inhibited. They all turn off. And that further predisposes us to more hip problems, but also predisposes us to groin problems and things like osteitis pubis, from what we've seen with many of our athletes that are suffering or have suffered with these problems in the past. So our femoral nerve is really, really important. So if you're finding that your hip movement is limited in extension, which often happens as well with degeneration, but if you find that the hip extension is limited, this could be the cause of your problem, femoral nerve entrapment. It's a very, very common thing that we see. The other thing that this nerve supplies as well is the outer area of your thigh. So right through this outer area here. So it supplies the skin in that area. And there's a common condition in this area called myalgia paresthetica, but basically what it is that area of the skin on that side of the thigh either starts developing a burning sensation or a numbness feeling. And that happens because not only does this nerve cross through a little canal there, a small portion of it actually goes through a muscle that sits on the side of your thigh here, which tends to get more overworked when your hip flexors aren't functioning very well. And the net result is we get jamming in this area here, and this creates this whole numbing effect or burning sensation that goes down the side of the thigh. So this is our femoral nerve, very, very important nerve for people suffering with hip problems and with that hip bursitis type feeling as well. So if this does sound like you and you want some more help or some more information, just message me and I'll talk to you whether this might be a problem or not. Remember guys, it's all about adding life to your years, not just years to your life. See you in the next vid.